Hi, welcome to Health Talks. South Florida women can benefit from a new one-stop comprehensive women's health alliance offered by UHealth University of Miami Health System, the first such fully coordinated program in the region. And here with me, I have Dr. Morgan A. Oh my God, that last name. If I have a problem with the termini, imagine you. Doctor,
Yeah.
how do you pronounce
Shane is
that?
fine. Dr. Shane is perfect.
Dr. Shane.
Very nice to meet you.
She's a clinical assistant professor in the Division of Gastroenterology and the director of the UHealth Comprehensive Women's Health Alliance. So we're going to be talking today about that. I'm very excited. And Doctor, what inspired you Health and you to create this Comprehensive Women Health Alliance, and how does it benefit women in South Florida?
Great question. So really two things. One is from my clinical practice and one was purely selfish. So I see a lot of women in my clinic, mostly because of the type of diseases that I'm constantly treating: complicated constipation, irritable bowel syndrome, pelvic floor dysfunction. Being a female gastroenterologist, I attract more women patients in general. So that's kind of how this all started, noticing that my patients were not necessarily getting coordinated care the way that we really would benefit. And it was, not necessarily, they were having trouble getting scheduled for certain services, just like the rest of us. And like I said, my second motivation was purely selfish, because me, my friends, other people just like me, we're all doing the same thing. We're busy, we're working, we're taking care of parents, we're taking care of our kids, we're taking care of our houses, we're trying to, stay afloat in 2023, just like everybody else. And so that to-do list is very long. And the things for yourself, like scheduling your routine appointments, unless you're having a problem, you may push those less urgent things off. And the goal was to make it easier to knock down some of those personal barriers that people have, those time constraints, make it easier to schedule, and hopefully funnel more people back into the health system so they can get the preventative care that they need.
Because we all have busy lives, and we know that we are the ones in the household who manages everything, like especially appointments.
Yeah, for everybody, your kids' allergies, your husband or wife's, PCP,
mom and dad, and
the pool cleaner, like you name it, you're the one getting all the phone calls for, everything. And at the end of the day, which phone calls are you going to make? Many women put themselves last. We're natural caregivers. We're going to make sure that everyone else is taken care of. And if we have time, great, I'll get to it. But if not, we may not. And before you know it, it's 4:57. You're never going to get through on the phone. And that one appointment that you needed to call gets bumped to the next day and the next day. And before you know it, it's been 6 months, a year, 2 years. You're behind on your mammogram. You missed your colonoscopy. Like, regular people things. You're 3 years late on your pap smear. All of these general preventative care appointments kind of get brushed to the side because we forget about keeping ourselves healthy when we are healthy. And, we really need to focus on prevention rather than treating a problem.
I like that. That's my approach. And that's why I started 14 years ago writing a blog, when I started realizing that I need to take care of myself and to really, really pay attention of everything that was, happening in my body back then. And, it's been 14 years, and that's why we're here with you. And I really appreciate that you have the time today to really share this news with my audience. And talking about my audience, I'm very excited about telling them about in this program, because I was into the website and reading about it, about the nurse practitioner that is going to take care of them. I think that's very important.
Yeah, so the goal is to create this medical home where you get that kind of personalized touch, both from the physician side and then also from the patient interaction side. So we've kind of created this closed loop. The nurse navigators, there are 2 of them. You're gonna call them, or they're gonna call you. They're gonna make your appointments for you. They can prioritize what's important to you. Maybe it's most important that you get your appointments on the same day. Maybe you don't care when they are, as long as they're only at one of our UHealth facilities. Maybe you prioritize one appointment and another one can wait a couple weeks because you can't get, that much time away, but at least it's on the books. you get to decide what's important to you, because our nurse navigators have the access to schedule across multiple disciplines, which is not really available without the program. So then on top of that, you see the provider, and then those nurse navigators are calling you back, finding out how your appointment went, following up on what tests need to be ordered, giving back results for the provider. So you feel like you have someone you can speak to, rather than a nameless, faceless person at any of these offices. These nurse navigators become your point of contact for any issues you have, any results you need, kind of creating this medical home for you, so you feel empowered to take better care of your health.
I love that. I love that. I was reading through the whole website, and you have so many things that we can do. It's like the website said, it's just a one-stop place, so we can all take care of ourselves.
And there's a lot of good information on the website.
Yes.
Good patient-related information, which I think is really valuable.
And you can make the appointment on the website, right, doctor?
You can take an intake form, and then the nurse navigator will see what you need, and then ask you more questions when they call you back, and kind of get it all done in one, 10-15 minute phone call, as opposed to, and there's no like waiting on the phone. If the nurse navigators are busy, you go straight to a voicemail and they call you back. There's no like phone tree, press 7, press 12, press 29. You're going to speak to a real person at our facility who knows what's happening in the program. They're not going to transfer you all over the institution. If they don't have an answer for you right now, they have your number. They're going to call you back and close the loop if they can't do everything that you need in that moment.
So basically you put up with a program, like you like created a program that really summarized everything that you wanted to do with yourself when it comes
to patient. I need, I need my regular screenings. I need a primary care doctor. I need my gynecologist, all those other things. I need my skin checked once a year, just like everybody else. And then we have some additional women's focused services that we notice in our patient population are being sought after by women exclusively or more often. Obviously, everyone needs their primary care doctor. Everyone needs a colonoscopy or colon cancer screening once they reach an appropriate age. If it's 45, if you're average risk, it may be earlier than that if you have increased risks. Everyone needs their skin check. Those are like the bare minimum for everyone in the entire population. But women need some special attention. Gynecology, special women's health, GI related services, breast imaging, all those things that are maybe more women specific. We also have direct inroads with all of those services so that we can get that taken care of too. So it's preventative medicine plus.
Doctor, is it easy to switch? Because if I want to go, for example, I'm very tired of having one doctor here, one doctor there, one doctor at Miami. So now I'm going to visit you because I like to do it, but I don't like to do my exams at the end of the year. I like to do it at the beginning of the year. Everybody's hurrying up at the end of the year.
Yeah, we're very busy. You come November, everyone's met their deductible. They're trying to get in before the end of the year. It's a very busy time for doctors.
So the beginning of
you can do it anytime you want. You could tell us now that you want your appointment for January. We have that capability, and you can get it on the calendar and work your whole life around it. This is one piece of a gigantic puzzle that makes up your whole life. And so we're here to, cater to whatever is going to make you have an easier time and whatever's going to get you through the door to get your appointments done, because getting it scheduled is the first hurdle. Getting to the appointments the second one, and then honestly carrying out whatever your doctor recommends is that last step. And all of those things require a lot of input from any patient. And we recognize that it's difficult to be a patient in 2023. The system is enormous and very difficult to navigate. So we're trying to make it a little easier through this program to cut down some of the time.
Perfect. To our viewers and my followers, and if you or someone can benefit from this innovative program, don't hesitate to visit the website. I'm going to share it with you and to learn more. And if you're ready to take the first step towards comprehensive women's health, you can call them. Do you know the phone number by?
Yeah, I do actually. I'm going to make sure I give you the right one. Okay. But I believe it is 855 all women.
3-4 women, right?
Yeah, let me give you the right one. I don't want to ruin it for you, so we can slice it in correctly. You have and the most important thing is to just do it, right? Like,
Yes.
take that first step. There's a ton of great information on the website, good patient health information, not just like the services that we offer, but actual patient, like, good quality patient information, top 10 symptoms people experience, that's been vetted by physicians, but it's not too hard to navigate. There's a lot of information on the internet that's not always correct.
I have the phone number.
Yeah, it's 855-34-WOMEN.
Exactly.
WOMEN. So 34 and then 96636.
Perfect. Thank you so much, Doctor, for sharing this amazing info. And I look forward to seeing you soon, because I'm going to switch and I'm going to do everything there, because I'm
waiting for you. We're ready, Laura. Anytime you want to come over.
I'm the kind of patient that I'm good with appointments, but since my schedule is kind of crazy and sometimes I'm traveling, I'm the one calling the nurse saying, if somebody cancels, call me.
Well, this is for you, right? Now you'll have someone to call, and now you can make your appointments whenever you want them, when you know that you're going to be in town.
Thank you so much, Doctor, for your time in this interview. Thank you so much. Bye-bye, guys.